Welcome to Study Nurse IQ. I'm Ginny. Today I'll guide you through this comprehensive tutorial on peripheral IV insertion. We'll cover everything you need to know about this essential nursing skill, from preparation to completion, along with helpful tips and practice questions to reinforce your learning. Peripheral for insertion is a vital nursing skill that gives direct access to a patient's bloodstream through a peripheral vein. This essential procedure allows nurses to administer medications, fluids, and blood products directly into the circulation. It's one of the most common medical procedures performed in healthcare settings, making it an essential competency for all nursing professionals. Whether it's for medication administration, fluid replacement, or blood product delivery, mastering IV insertion is crucial for providing effective patient care. Let's review the essential equipment needed for IV insertion. You'll need an IV catheter and needle of appropriate size, a tourniquet for vein identification, alcohol swabs or chlorhexidine for skin preparation, sterile gauze, transparent dressing, medical tape, clean gloves, and extension tubing or IV administration set. Having all supplies ready before beginning the procedure ensures a smooth and efficient process while maintaining sterility. Before starting the IV insertion, proper patient preparation is crucial. Always begin by verifying patient identity using two identifiers and obtaining informed consent as per facility protocol. Assess the patient's medical history for any contraindications or special considerations. Carefully examine potential insertion sites, looking for healthy veins that are visible and palpable. Position the patient comfortably, typically with the selected arm supported and slightly below heart level for optimal venous filling. Proper hand hygiene and personal protective equipment are non-negotiable steps in IV insertion. Begin by performing thorough hand hygiene using alcohol-based hand rub or soap and water as per facility protocol. Don clean gloves and protective eyewear to protect both yourself and the patient. Remember that maintaining sterile technique throughout the procedure is essential for preventing healthcare-associated infections. When selecting a vein for IV insertion, start with the most distal sites on the non-dominant arm and work your way up if needed. The best veins for insertion are typically found on the forearm or back of the hand. Look for veins that are straight, bouncy, and refill quickly when compressed. Avoid areas with bruising, inflammation, or previous IV attempts. The cephalic and basilic veins are excellent choices, but remember to consider the purpose of the IV and expected duration when making your selection. Let's begin with the first step of IV insertion. Position the patient's arm comfortably and apply the tourniquet about 4 to 6 inches above your intended insertion site. The tourniquet should be tight enough to restrict venous flow, but not arterial flow. You should still be able to feel a pulse below the tourniquet. Allow 30 to 60 seconds for the veins to become more visible and palpable. During this time, you can have the patient make a fist or hang their arm down to enhance venous filling. For proper skin preparation, start by cleaning the insertion site with an appropriate antiseptic solution. Use a circular motion, starting from the center and moving outward. This technique ensures that you're not dragging contaminants back into the clean area. Allow the antiseptic to dry completely. This typically takes about 30 seconds. Remember, once the area is cleaned, do not touch it or allow anything else to contact the site. Now for the actual insertion technique. Hold the catheter at a 15 to 30 degree angle, bevel up. Stabilize the vein with your non-dominant hand by pulling the skin taut below the insertion site. Insert the needle smoothly through the skin and into the vein. You'll know you're successful when you see a flash of blood in the catheter chamber. Once you see the flash, lower the angle slightly and advance the catheter about another 1/4 inch to ensure you're fully in the vein. After successful insertion, it's crucial to secure the IV properly. First, release the tourniquet. While holding the catheter in place, withdraw the needle completely and dispose of it in the sharps container. Connect your primed IV tubing or saline lock, then clean the site again and apply your sterile dressing. Secure all tubing with tape to prevent pulling on the catheter. Finally, verify proper placement by checking for easy blood return and smooth fluid flow. Be vigilant for common complications that can occur during or after IV insertion. Infiltration appears as swelling and coolness around the site. Phlebitis presents with redness, warmth, and tenderness along the vein. Watch for signs of infection like increased pain or fever. Occlusion may occur if the catheter is kinked or clotted. Extravasation of certain medications can cause tissue damage, so prompt recognition and intervention are essential. Documentation is a critical component of IV insertion. Record the date and time of insertion, catheter size and location, number of attempts made, the type of dressing applied, and the patient's response to the procedure. Note any complications or difficulties encountered. Include your signature and credentials. Proper documentation not only ensures continuity of care, but also provides legal protection. Let's practice with an NCLEX-style question. Question 1. The nurse is preparing to insert a peripheral IV. The patient has a significant amount of hair at the chosen site. What is the most appropriate action for the nurse to take? A. Use a straight razor to shave the area. B. Skip this site and find a different one. C. Trim the hair using electric clippers or scissors. D. Secure the IV over the hair as it's not a concern. Answer C. Trim the hair using electric clippers or scissors. Rationale. The correct action is to trim the hair with trimmers or scissors to ensure the dressing will properly adhere to the skin, which is crucial for preventing infection and dislodgement. A straight razor is contraindicated because it can cause microabrasions, increasing the risk of infection. Question 2. After successful venipuncture and observing blood return, the nurse advances the IV catheter and threads the cannula into the vein. What is the next immediate action? A. Begin flushing the IV line. B. Release the tourniquet. C. Apply firm pressure to the site. D. Engage the safety mechanism to remove the needle. Answer B. Release the tourniquet. Rationale. Releasing the tourniquet is the immediate next step after the cannula is threaded into the vein. This action restores normal venous blood flow and prevents a hematoma from forming when the needle is withdrawn. Question 3. The nurse is teaching a student about IV flush techniques. The nurse explains the importance of using a push-pause method. What is the primary purpose of this technique? A. To prevent the patient from experiencing pain. B. To avoid creating positive pressure in the vein. C. To reduce the risk of infiltration. D. To dislodge clots and clear the line more effectively. Answer D. To dislodge clots and clear the line more effectively. Rationale. The push-pause technique creates turbulence within the catheter, which helps dislodge any microparticulate matter or clots that may be forming at the catheter tip. This ensures the line remains patent and ready for medication administration. Let's review the key points of successful IV insertion. Always prioritize patient safety by following proper identification and assessment protocols. Maintain strict sterile technique throughout the procedure. Pay careful attention to proper insertion angle and technique. Secure the IV properly and document thoroughly. Regular monitoring for complications is essential for optimal outcomes. Thank you for joining me for this IV insertion tutorial. Remember, becoming proficient at IV insertion takes practice and patience. Don't get discouraged if you don't succeed on your first try. Every experienced nurse was once a beginner. Keep practicing your technique. Always prioritize patient safety, and you'll develop this essential nursing skill. Good luck with your learning journey.